Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. But prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matangisda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So, hindi niya na nararamdaman na may natapakan pala siya. So, probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so, anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot. Tapos, tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung hindi mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-pick yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakitaan ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung mo ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulite siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya. na dating wala. Makikita nyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titingnan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si 𝘗𝘗𝘈𝘍𝘗𝘗 Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, try ko daw itong yung PPAR. Pangalawang gabi, naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag ko, parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. Ay 𝘗𝘗𝘈 Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
We are live. Good evening and welcome to the Simply Healed webinar, where we turn complex science into simple and practical steps you can use right away. My name is Sheila, your Senior Client Service Officer here in Simply Nature. And welcome to Simply Healed webinar. Huge thanks to everyone who joined our VIP meetup last night. We thank you for your continuous trust towards our service and our Simply Nature products. Your questions and stories made the session powerful and full of hope. Congratulations to our raffle winners. Please message your assigned client service officer to claim your prizes and avail the exclusive promos until tomorrow, October 24, Friday. Tonight's session is part of a series designed to help you tame inflammation, because calmer inflammation supports better energy, recovery, and quality of life, entitled Inflammation and Cancer: How to Tame Inflammation through PPARS and Why It Is a Must. Now, to begin, let's align on a simple picture. Inflammation is your body's alarm and repair system. Short bursts help healing, like fire brigade putting out a small fire. But when the alarm stays on, the smoke lingers, fatigue, soreness, and slower recovery. During cancer treatment, calmer inflammation supports quality of life and helps you stay on track. If you're nodding to any of this, fatigue, mouth sores, gut soreness, appetite swings, or poor sleep, that's often the noise of inflammation. Recognizing it early lets you act sooner with safe, simple steps. PPARs are like tiny dimmer switches in cells. PPAR alpha helps you burn fats more cleanly, which can steady energy. PPAR gamma helps turn down excessive inflammatory signals and support insulin sensitivity. When these switches are balanced, many patients report feeling more better through the day. As a mom who walked this road, I want you to hear this. You are not alone. Calming inflammation is doable and coordinated with your care team, and it can make everyday life feel more livable. To answer your questions in this modern world filled with noise and different health opinions, trust the ones from the experts. First, we have a seasoned international speaker on a wide range of topics, from personal health to healthcare, who is also the founding director of Simply Nature International, our PPARS expert from Singapore, Mr.Shyan Lim. Up next is, of course, Dr. Jansen Calalan, a graduate of St. Luke's College of Medicine, a diplomate of International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center, Las Piñas, Tree of Life Wellness Center, Centro Holístico, and Simply Healed Medical Group, where he practices integrative oncology. Good evening, Sir Shyan, and good evening, Dr. Jansen.
Good evening, everybody. Good evening, Doc. Good evening, Sheila.
Hi. Good evening. Good evening.
Good evening, Doc. Well, it's so nice to have you both tonight. And sir, thank you for answering the questions, of course, last night for our VIPs as well.
Yeah, so before we start, I would like to just kick off with, Doc, I heard that in Philippines, there's COVID cases are actually rising. Is that true?
I have no idea.
Okay, that's what we heard over here. But
I'm not
definitely
looking, I'm not watching these trends anymore.
so COVID has really become another seasonal flu lah.
Yeah, it's well, it's expected to be that way.
Yeah, and it's no longer so scary like when it first outbroke, right?
Yes.
We shouldn't panic lah. We shouldn't panic. Okay. All right. That's a good that's a first question by me. First job by me. I hope that gives everyone in attendance some comfort to be comfortable. Don't panic too much about this if you hear about COVID-19 increase because I think not only in Philippines, I believe in Japan as well. And Singapore, we're also going through a flu season. So many people are a little bit under the weather. So everybody do take care of yourself. Yeah. Sheila?
All right. Okay, so for our first question, thrown to us privately, question is, can you recommend any laboratory to know the status of my grandfather who decided to take PPARs for his cancer treatment?
Yes, this is a same question yesterday. So
Yeah.
Doc, we just want to hear from you because I know you have you can refer them to our GCC. Yeah.
Yes, but this is a very generic question.
Okay.
To
How would you
recommend
approach it?
specific, yeah, to recommend specific tests, no, I have to interview I have to interview you, know the history, what prior tests have been done, so I know what to
Okay.
request for. Yeah, so basically that's how it is. But for cancer treatment response monitoring, well, you rely on imaging and your tumor markers, and to go into to have a what how should I say, to have more details or to get more advanced tests, no, that goes beyond the these traditional laboratory tests that oncologists usually do. You can go for RGCC test, the liquid biopsy test. Yeah, because that test can detect cancer even if the imaging studies are negative for the cancer already. Yeah.
To everyone, especially to the viewer who asked this question, and for others who are wondering about this, right? If you do go for any RGCC test, right? That means if you go for any diagnosis that is not prescribed by your oncologist, then I would strongly recommend that you take on a doctor for consultation. So if you don't know any doctor, I mean, definitely Dr. Jansen is one of the top integrative cancer doctor. So why? The reason why is that these diagnostic tests are not cheap. Okay. So, and also there will be a report that comes with the diagnosis test. And you should have you're supposed to develop a strategy from the report. So if you don't have the medical background, going for such an expensive test may not be so useful to you. You may interpret it wrongly. That's even worse, right? You may scare yourself when there's nothing to be afraid of, or you may be over optimistic, thinking that everything is fine when it does not necessarily mean so. So if you're going to do any diagnostic test like RGCC test, like for this particular viewer who asked this question, I strongly encourage you to have a doctor already consulting with, and let that doctor help you make sense of the tests that you take. All right. So of course, Dr. Jansen will be ideal. Yeah.
Before we go to the next question, I just want to greet our viewers for tonight. Miss Noemi Veras, Angela Reyes, Miss Jeanette Pu of Child House Manila. Good evening po. Rosa Peglidrigito, Edna Aveo. Yes, thank you so much for watching us tonight. Now, for our next question, also thrown to us privately, question is, who is a good candidate to consider PPAR active nutrition, and who should not use it without close medical supervision?
It's best for patients who are undergoing chemo, radiation, therapy, yeah, those kinds of patients. Patients who are also who have trouble, who are malnourished. Yeah, those kinds of patients are the best candidates to use PPARs. For the second question, who are the patients should not be taking this? Well, if you have allergies to algae, then you should not be. Yeah.
Add on to Dr. Jansen, in case some of you are allergic to seaweed, all right? Allergies to seaweed is different from allergies to algae, okay? Because seaweed is literally, as you from the name, it's from the ocean, salt water. So salt water and freshwater aquatic vegetables, plants are very different in nature. One big difference is the presence of iodine. All right. So many people who are allergic to seaweed are also allergic to iodine. So so do take note. If you're allergic to seaweed, so you can't eat things like sushi and things like that, it may not mean that you're allergic to algae. All right. So if you can safely take chlorella, which is a freshwater algae, you will be fine with Simply Nature's microalgae.
Okay, thank you. Thank you, Dr. Jansen. Thank you, Sir Shyan. Thank you. So for our next question, what mistakes will, okay, coming from Miss Joyce, what mistakes will make other patients think it didn't work for me, and how do we avoid them?
What mistakes?
Will make other patients
Or maybe
It's a
Doc,
very
maybe
good question.
I
Yes.
rephrase the question. Doc, you know, many patients, right, go through similar treatments for cancer. And some people get cured, and then some people don't. Why is this the case? What are some of the reasons? Yeah, I think this is what someone is asking. Did some people do something wrong?
Yeah.
You are okay. Here maybe a even better question for your specialty, right? As an integrative cancer specialist, what do you add to the fight? What would you do in addition that is different from a normal oncologist, right? Where is your strength that helps the patient?
So this is a very good question. It is the nature of cancer. It's the nature of the disease itself, no? So because cancer cells mutate, sometimes they can develop resistance to treatment. So the treatment that you're giving might not work down the road. Another thing is in a tumor, so in a tumor, right? You have cancer cells, and the cancer cells, as they divide, as the tumor grows, the cancer cells mutate, so they deviate from the parent cancer cell. Okay, so in a way, they are cancer cells of the same organ, but genetically speaking, they are different. So when the doctors give treatment, there are specific cancer cells that would die from the treatment that was given. But there will be some who would be resistant to treatment. Okay? So this is why we see patients not responding to treatment or with incomplete treatment response. Okay? This is the reason. Now, how do I address this? Okay? So the way I approach cancer is 3 ways. I starve it of its fuel. I make sure the immune system of the patient is strong. So, immune system, risk factors of the patient that predisposes the cancer to grow. So I address that. So the body itself. And number 3, to kill the cancer cells directly. So this is how I approach things. Now, the oncologist zeroes in only on killing the cancer cells and reducing the tumor burden, or removing the tumor from the patient's body. Okay. So with this approach, aside from PPARs, I use a lot of immune boosters, different kinds of immune boosters. So, there are 4 immune boosters that I use primarily. One is Simply Nature PPARS. I use rice bran, shiitake mushroom, and wheat germ extract. So these are the 4. There are still others that doubles as immune boosters and cytotoxic or cancer-killing substances, like your mushrooms, so like agaricus and cordyceps. So these are quite similar to your shiitake mushroom. Yeah. Now, I also use repurposed drugs. So these repurposed drugs are medications, pharmaceuticals, which are available in the market, which are FDA approved, but in third-party research, clinical research, it has been shown that these drugs are also able to kill cancer cells and influence the cancer cell metabolism. So I repurpose these drugs for cancer as well. So I'll give you an example. Metformin is a medication for diabetes to reduce insulin resistance. Metformin also can help reduce the absorption of cancer cells of glucose and glutamine, which are the two fuels of cancer cells. No, so I use metformin for cancer patients as well, even if their blood sugar is normal. By the way, metformin can also help reduce chemotherapy resistance. Yeah.
Isn't that interesting, everybody? That's a diabetes control drug, all right?
Yes.
Yeah.
Yeah, so this is how do I know when it's biochemistry, basically. So it's I learned that from the Orthomolecular Medicine Society.
No, I have a question. How come? First of all, metformin is actually a very safe drug. Of all drugs,
Yeah.
it's actually a very safe drug, and it's a drug that, in a sense, you can take over a long period of time and not have any big concerns about side effects. So how come oncologists don't use it? How come only integrative cancer specialists like yourself will use this knowledge? What is stopping a normal onco from using it?
Well,
Or
they
if it's not
already-
convenient to say, then just keep quiet.
well, number one, they already have their tools. I mean, they already have their chemo, their targeted therapy, immunotherapy. So they won't bother learning these other things. Although the oncologists, especially medical oncologists, are internal medicine doctors as well. So there's no stopping them from prescribing this if the patient is diabetic. Okay? So
Actually, there is also a possibility that okay, I'm just guessing here. Just let me know if it's fair. There's also, when you are part of a hospital, there are standard protocols for different type of treatments, right? And as a doctor working for the hospital, it's also very likely that they will just stick with the protocols and not go out of it. Maybe is that possibly one of the reasons why oncos wouldn't use, like, for example, repurposing of drugs? Because I also know in hospitals, the lines are drawn very clearly. Certain drugs belong to an endocrinologist. Certain procedures like scoping of the GI is really restricted to the gastro specialist and not to the general surgeons. So they are like professional courtesy. I wouldn't say it's like hard lines, but there's a professional courtesy that stops many oncos from experimenting like this because they have colleagues in the hospital also, right?
yes,
Yeah, so it's a kind of a politeness lah, but the politeness actually restricts them lah. Let's put it, look at it in the most positive way.
Yes. So
Yes.
but again, there's no. I mean, any doctor can prescribe metformin.
Yes, every doctor can.
Even non-specialists can, no. So
Yeah.
there's really nobody stopping from anybody prescribing these drugs to cancer patients, repurposing them, no, as long as the doctor explains well why the medication is being prescribed. Then if the patient acknowledges, then shouldn't be any problem. Yeah. So repurpose drugs. Okay, so that's an example. Infusions, I also use infusions like intravenous high-dose vitamin C. So that's part of infusion, nutritional infusions already. Yeah, so there's still other things that I use. But basically that's the gist on how I approach cancer treatment. So for my patients, I have my own protocol, but I still do refer them to oncologists because I cannot prescribe chemo. I'm not trained to prescribe one. I'm not a surgeon. So, if there's a tumor, the best way to reduce tumor burden is to cut it out. I mean, that's a given. Surgery is the single most important therapeutic approach to increase the overall survival of a cancer patient, no? So, and once the tumor has been removed from the body of a cancer patient, the treatment really becomes simple because the headquarters of the cancer is already removed, no? So that's basically how it is. So it's a collaboration between the conventional oncology and integrative or conventional, or how should I say, alternative medicine. But yeah, by definition, it's not alternative medicine, but it's integrative medicine.
It's
or
integrative, not
non-conventional.
alternative.
Non-conventional. Yeah.
I just thought of a simple analogy for everyone to be able to understand the approach to fighting cancer. And I will ask everybody this question, right? So who is more important in your treatment for cancer, Dr. Jansen or your oncologist, right? So let me give you an example, right? If you were a basketball player, okay, if you're a basketball player and the upcoming game is the finals, maybe NBA finals, and you are the key scorer, you are Michael Jordan, if you are from my generation, or LeBron, right? If you're the current generation. Okay, now who is the most important person that will help you win the fight? So it's an NBA game, right? So NBA game, if you win the fight, it's like you beating cancer. Is it your coach that teaches you the strategy? Is it your shooting coach which helps you do your train you in your 3-point shot, right? Or is it the massage person that relaxes your muscles every time after you practice so that you can practice again tomorrow, right? Or is it the person that warms you up? Is it your nutritionist that watches your diet so that on the final game day, you are at your peak of health? So which one is the one that will cause you to win the NBA final? The answer is all, right? Maybe you have a knee injury, and without your muscle therapist, even though you're the most talented 3-point shooter, without your massage muscle therapist, even with the best coach, you cannot make your 3-point shots, right? So I would say that the oncologist is like the shooting coach. He literally helps you shoot and score, right? And integrative medicine, with all its different protocols, is the person that makes sure that you have your isotonic drink while you're resting on a bench so that you recover, the person that massages your legs so that you don't cramp, so you're ready to play on the big day. So all these are all important. If you only have the shooting coach, you're not going to be the best player and you're not going to be the star player, and your chances of winning the game is going to be diminished, right? So you need a whole team in order to become the most valuable player winning the NBA finals, right? So I hope this analogy helps you. There is not saying the oncology is more important. There's nothing saying that PPARS is more important than chemotherapy. If you have chemotherapy without PPARS, the chemotherapy might kill you from complications, right? You have PPARS without the chemotherapy, your chances of killing an aggressive cancer drops dramatically, right? So there is no one that is important, which is why I think what Dr. Jansen is doing as an integrative specialist in dealing with cancer, he is more than the shooting coach. He is the massage therapist, the nutritionist, and also the warm-up coach, right? Pre-game, after game, pre-practice, after practice warm-up, to make sure that you can execute the shooting techniques that the shooting coach teaches you, right? So that you can execute your 3-point shot and win the game. So I hope this simple analogy helps you understand that to win against cancer, it takes a whole team. It takes different approaches. It takes you to not think of one magic bullet, but Dr. Jansen always teaches about from different approaches, right? And this is the reason why some people succeed in their fight against cancer and some don't, right? Because some people's team is not so complete. So they have all the shooting practice, but on game day, they cramp up and they cannot shoot, right? So this is why, in the end, their cancer treatment is not ideal. So different people have different weaknesses. Some have leg injuries, some have bad back, some just have poor nutrition. So different people need different strengths in a team in order to make sure they do the best for cancer. So just copying someone else may not give you the formula if you are different from that person. And most likely you might be. So again, I will advise you to have a consult with Dr. Jansen. All right. So because he's the one in 5 coaches in one. Your uncle is the main shooting coach, but he's the one that will make sure everything comes into place. Yeah.
Thank you. I love the analogy, Sir Shyan. Thank you. And of course, For those of you, I just want to echo out for those of you who wish to have a consultation with Dr. Jansen, for you to be able to have someone looking into your situation, your case on an overall approach and level. We have Dr. Jansen here, and you can just type in how to consult. Our caring HCS, Miss Beth and Miss Irish, will definitely get in touch with you. Okay, thank you. For our next question, coming from Miss Cecilia. Question is, Doc, my CA125 is at 35. I used to be borderline before. Can I stop CA125 monitoring now? I had the total hysterectomy in 2023, and after the biopsy, it was at 50. I feel like I want to stop the checkups. I just want to buy PPARs instead. How much is it, and how do I take it? Thank you.
My opinion is you should not stop the monitoring. Yeah, because that's how you catch cancer early. Now, for CA125, this is it's a non-specific tumor marker. Okay, so there are a lot of things that can cause CA125 to go up, but nevertheless, it's still good to have it monitored once in a while. Okay, now for that matter, for PPARS, at this point, I would choose powder. Just maintain on the powder. Then, yeah, around 2 scoops twice a day would suffice. That's the minimum amount Simply Nature recommends. If it's too expensive, then you can go down to soft gel. But yeah, I won't stop monitoring. Yeah, I won't stop monitoring because that's how you catch cancer early. The moment you stop monitoring and leave it to be, then you're like hoping that don't get cancer anymore, praying that you don't get cancer, but you're not doing the necessary things for you to catch it early. So it's like that. No, it's like that.
No, I'm also trying to remember the statistics for if she has a hysterectomy, then she most likely has ovarian cancer, right?
There are a lot of cancers, that can warrant a total hysterectomy. But
yeah, because I remember ovarian cancer has a very high recurrence rate.
Yes.
So and even after hysterectomy, there is actually still a high recurrence rate. So just to be on the safe side, if you happen to have that cancer, it's better to keep monitoring it. Don't look at it as something. Don't look at it as a fearful thing. Look at it as an insurance rather. Right? Like every time you monitor, you make sure that you're cancer free, rather than every time you monitor, you're wondering, am I cancer? So let it become a comforting thought for you, a comforting process, keeping you cancer free rather than you're afraid. Is it expensive to go for checkups, Doc?
No, not really.
Right?
But this level of CA125, because the comment, the timing hasn't been established well. So I really have to talk to the patient to make a recommendation on whether or not to go for the CA125 monitoring or to recommend more tests. But CA125 is unique to ovarian cancer. Well, now if after surgery, usually CA125 goes down really low, really low. Assuming that the cancer has not spread yet. Now, a CA125 of 35, which is in the borderline value, I would further check. If there are other things that might have been causing the CA125 to go up. So the 35 number, I am not comfortable. Okay? Yeah. I am not comfortable with this number because after surgery, it should go down really low. But I don't know what happened to the CA125 in between because this is a span of 2 years. So yeah, 35 is a number that I am not comfortable unless there are a lot of CA125 tests which also shows a number around 35. So 30s. Yeah, if it is so, then I won't worry because the number is flat. It's not increasing. The trend is flat. Okay, so you have to take a look at the trend as well. So I wouldn't. So bottom line is 30. A CA125 of 35 at this point. No, I'm not that comfortable. I might do more tests like a PET CT scan just to double check if there are any recurrence if it hasn't been done yet, or perhaps an abdominal and a chest CT scan. Yeah.
All right. So
How
there
about-
you go.
Sorry, how about PPARs? This part of the question. Which one would you recommend?
You recommended powder 2 scoops.
Powder.
I
Yeah,
see.
powder. So why powder? Because I am not comfortable with the 35. That's the reason. Okay.
Okay.
Thank you, Dr. Jansen. Sir Sean, would you like to add anything?
No, I think Dr. Jansen was very comprehensive. Yeah.
Okay, thank you. All right, for our next question from Ms. Rosa Rodriguito. I've done my oral chemo 2022. I've already taken PPARS powder and capsule. And thanks God, I'm getting well. I take PPARS tablet daily. My question is, do I continue as my maintenance the PPAR tablet?
Yeah.
Yes, you continue. You continue. Now, if you're asking when to stop it, then we need more tests.
And I will add in, there is no reason to stop it, okay? Let me give you many reasons apart from cancer, okay? I've never had cancer, okay, and I don't ever plan to have cancer. I take PPAR tablets as my basic foundational general supplementation, right? So I take it to manage my metabolic pathway. So I take it to manage blood sugar, blood cholesterol, general chronic inflammation to be a healthy level all the time. And it also leads to the question, many people ask, what can we do to be anti-cancer, right? To become anti-cancer. To be anti-cancer means to remove all the risk factors in cancer. If you demonstrate less risk factors in cancer, then you are less likely to develop cancer. So having healthy blood sugar levels, healthy blood cholesterol levels, having healthy inflammation levels, that means no chronic inflammation, all this makes you less likely to develop cancer. And of course, for cancer patients who have beaten cancer, it lowers your chances of recurrence happening. So tablets are actually very affordable. They are just about the same price as high quality multivitamins. So consider it as part of your supplementation. And the final benefit is Meron anti-aging lung. So if you want to see evidence, then I'm evidence. My wife is evidence. The staff is evidence. Dr. Jansen is evidence. Okay, I've been taking it for more than 15 years, actually 20 years, I think, around there. So I'm age 51 this year. It's a really good basic supplement, right? So there's no reason for you to stop taking tablets. And I do encourage you to do it because the Filipino diet, meron mas high blood sugar lang. So yeah, I definitely got the supplement to make sure that you are healthy. Yeah.
Thank you. She actually made a follow-up comment that her cancer is actually bone marrow myelofibrosis. Well, don't stop taking PPARs.
Yeah.
Our next question coming from Mr. Sonny Dizon from Lazada. Which PPARs is for benign prostatic?
Benign prostatic hyperplasia soft gel would suffice. But that's the type of PPARs that would be okay to use for benign prostatic hyperplasia. Better if you combine it with the tablets. Yeah, but okay. But to address the benign prostatic hyperplasia itself, you should not stop with just PPARs. Okay, you have to do more. Okay, proper assessment has to be done.
So have a consult with Dr. Jansen. All right. Yeah.
Once again, for those who wish to have a consult with Dr. Jansen, kindly type in how to consult. Our HTS will definitely get in touch with you individually. Okay, for our next, yes.
I just wanted to add, because we've not mentioned it in this program, this particular episode, everything that we are sharing is for educational purposes, right? It's not an actual consult. So anyone with any illness, please remember this is an educational program. What we aim to do is for you to have an idea so that you know that there's a solution. You're confident that if you go for a consult, you will be able to find a solution. You have a general idea what is the right possible strategy options for your particular illness, so that when you meet your oncologist, when you meet your integrative doctor, when you have a consult with Dr. Jansen, you go in with a clearer picture, right? So that you know what to ask when you meet your doctor. None of our advice is actually advice for your case. What we are sharing on the program is simply textbook and our own experiences as a reference point. It is never to be taken as a consult, okay? It's very important, guys. Do remember, we don't know the details of your illness, and something as serious as cancer. Come on, we've got to take it very seriously. So if you go for an actual consult with Dr. Jansen, especially if you're going to take some specific actions, all right? Yeah.
Yeah, actually, I just want to share, before Doc Jansen does his consultations, apart from sending in, Doc, their laboratories, you are asking them to prepare questions. And
Yeah.
we learned this here in Simply Healed webinar that you have to ask the right questions to your doctors. So, yeah. All right. Okay. So for our next question coming from Ms. Angelina Reyes, a question is, may I ask if ivermectin human grade can be taken by cancer patient? Cancer patient is here. Oh, okay.
Yes, ivermectin can be. So that's one repurposed drug as well. So ivermectin is a deworming drug. Okay? Ivermectin, if you go into PubMed, or you can chat GPT this, no? So you can ask chat GPT to only search for clinical trials, published clinical trials, peer-reviewed medical journals that have information on ivermectin. You will see a lot of papers discussing ivermectin's anti-cancer effect. So to be specific, at which part of what part of cancer ivermectin does its work on? It kills the cancer stem cells. It kills cancer stem cells. Ivermectin can also help reduce chemotherapy resistance. Yeah, so I use ivermectin as well in my practice. Yeah. So the answer is yes. Question is how much you take. Depends on your weight.
You have to see Doc Jansen, of course. Okay. All right. Sir Shyan, shall we proceed to the next question?
Yeah. Let's a few more questions. Maybe tonight we end a bit earlier, but we have a bigger crowd today, so maybe let's just go.
Right. Okay, thank you. For our next question coming from Miss Mary, I'm taking PPARS powder and plus for benign breast lumps and diabetes for 2 weeks now, but I just found out, I'm 4 weeks pregnant. Should I stop this?
It's okay to continue. The benign breast lumps, I don't know if this is cyst or solid, no? But if they are cysts, nothing to worry about. I have a patient actually who have multiple breast cysts as well, and nodules. A lot of the cysts, well, that patient of mine have been on PPARS for 2 months. She's improving. A lot of the cysts actually disappeared already, but I told her to continue two more months, and repeat the breast ultrasound and see how she responds. It would also help with the diabetes. Yeah, so it's okay to still continue. No problem with this.
Yeah, and congratulations.
New mommy.
Yeah. I just welcomed my nephew, a new nephew yesterday. So yeah, congratulations. I'm an uncle again yesterday.
Congratulations.
Yeah.
Okay, for our next question coming from Miss Abigail, I've been taking PPARS powder, but I vomit after taking it. Could this be a part of healing crisis, or is it a sign that my body isn't tolerating it well?
I have a lot of questions for this
Mm.
question. Are you swallowing it?
Mhm.
When you take it, do you feel nauseous just by taking it? Because PPARS powder should not trigger vomiting at all unless
At
you're
all.
swallowing. Yeah, if you are swallowing it, then you might not be able to tolerate the powder. So I would suggest shifting to the tablets first, or the soft gel perhaps, no, and see if it still triggers the vomiting, or perhaps lower the dose of the powder. Take 1 scoop first, then see how you respond, no. But yeah, a lot of questions for this question, so I really cannot answer the question.
Yeah, but Doc, I'm like you. I am actually a lot of questions for this question. One, I okay. I don't think nausea. I think nausea and gag response is two totally different feelings, right? If you mean gag response, because sometimes some people when they inhale powder, they're very sensitive. It will cause them to right? If that's your case, right, try mixing the powder with a few drops of water, right? So that it's more like a paste or liquid, and then take it that way. Just to see, is it your gag response? If you take it and it triggers nausea, I would say that this is worth investigating because in my experience, Hexheimer reactions are indicative of other deficiencies that you may have, right? And other issues that might that your body might have, right? So this is something something I would suggest go for a consult with Dr. Jansen so that he can ask you more questions and be more specific. I think this requires more than you typing your response, right? Dr. Jansen will probably want to hear how you talk, your voice, maybe even your look. If he might even want to meet you personally, I mean face to face, so that he can do his diagnosis. But I found out. I found over the years, this is my experience, okay? They are perfectly healthy friends and who bought Simply Nature, even with just tablets. And then when they take it, they feel uneasy in certain parts of their body. Like for example, if they take it, then their kidney feels sore, all right? Or they feel discomfort in their lungs or something like that. And it has, for my personal experience, it has always been like a form of diagnosis. So if your kidney is painful, that means after taking something as simple as tablets, or you have migraines the moment you take tablets, that means even though you thought you were healthy, you are not. All right. It has always been the case. I think the reason why is that, if I put it in a simple layman's term, Simply Nature PPARs really triggers your body to modulate or go back to its original form or achieve homeostasis, right? So many times when we are ill, our body has already covered the symptoms. Just like a smoker no longer coughs because his lungs is used to smoke, correct? So you don't show the symptoms. I mean, even recently, Doc, I've had a few cases of like very, very healthy people who can run marathons and yet got cardio problem. Yeah, it has got to do with their high blood cholesterol. But marathon runners are actually quite thin, and their endurance is crazy, right? Their heart is so strong. So this is something that you would just think is impossible that they have cholesterol problem, right? But they actually do. So and it takes something to trigger for them to develop that mild heart attack or that surface this cholesterol problem. So by the fact that you take PPAR powder, if it's a nausea, it's really worth investigating. I just want to assure you, in my mind, it is very unlikely that the PPARs is causing is having a negative reaction with your body, it's more likely, but I'm not ruling anything out. It's more likely that your nausea is a symptomatic of something else that needs to be balanced in your body, right? Because it's an unusual reaction. Just like if someone takes PPAR tablets and then they say their kidney hurts. Why would PPAR tablet cause your kidney to hurt, or your liver to hurt, or an old wound to hurt, right? It doesn't make sense unless you understand that the PPAR agonist actually triggers your body to react, to heal, and then that's where the healing crisis concept comes in. Okay, so there are also some people with very sensitive, like for example, is it low blood or high blood or high toxicity level? They take PPARs, then they have migraines, right? They have migraines. So I've had, this is crazy. The most crazy case I've ever heard is someone who looks very healthy, seemingly very healthy. Three micro tablets, three micro tablets, she feels dizzy. So just by grammage alone, it doesn't make sense, you know. So it just tells me that although that person looks healthy, something is not right in their body, and it's a good time to go for a health screening and have a conversation with an experienced doctor. This is where I really want to digress a bit in the topic. You know, doctors like Dr. Jansen are very important. You need to meet experienced doctors because young doctors always rely on diagnosis and they have not seen enough patterns. Sometimes, so they always miss symptoms, which is why your specialists and your most renowned doctors, the best doctors are of a certain age. It's not saying that old doctor is a good doctor. And then, you know, in Philippines, any doctor that did their residency in PGH is a better doctor in general. Because in PGH, you work like crazy, right? It's a hospital where so many patients, but because in that 2 years that you do your residency there, you see 4 or 5 times the number of patients a person at a provincial hospital. So your experience, your ability to recognize symptoms is better. So when you are trying to identify something unusual and mysterious, you actually need a doctor who is more experienced because it's unlikely that anything in the textbook will help them identify. The doctor will say, you know what, your tests come out, everything is fine. And they can't explain why you feel these symptoms. It really requires an experienced doctor. Yeah. Just some information for you to consider.
Just very, very quickly, Doc Jansen, I have a question. Like,
oh, wow. Sheila, you have a question.
Very quickly. Okay. Would you say that a person who experienced unusual reaction after taking a new supplement like PPARS is in better status or better condition than those who doesn't feel anything unusual when they take PPARS?
Usually they are in the worst condition if they feel something.
Oh.
Yeah. For patients who don't feel anything at all, that means their body is in equilibrium already in the first place. So, well, other people just have reactions. I mean, it's really very difficult to pinpoint or pin this out, no? But in general, that's how it is. So if you're someone, if you're someone taking the supplements and you're not feeling anything, then your body is probably in equilibrium, and that's one. If you are having side effects, there's something wrong. Okay, or you're just reacting to the product itself. There's really nothing wrong. You're just reacting. Yeah, there are these reactions as well. Okay.
I totally agree with Dr. Jansen. If you take any supplements and you have reaction, that means that you have something off balance. Okay, but then I'm gonna go on the reverse, right? If you are healthy, if you are a healthy person and you take some activity or lifestyle choices, for example, you had a very heavy buffet, you went to Vikings and you went crazy. You would actually you might feel more nauseous than an unhealthy person. Because your system is cleaner, your organs are actually properly functioning, you are actually sensitive. You will actually feel the impact of your unhealthy choices. It's just like a person who eats normally very healthily, right? If you ask him to go to a restaurant, he will find all the food very salty. Why? His body is used to a correct healthy level of salt. So when he takes restaurant food, he'll say, hey, this is very salty. And like for me, I'm very sensitive to MSG. So as long as there's a little bit of MSG, I don't have breakouts. What I can feel is my hair feels like it's all standing. All right. But some people, even if you put 3 scoops of Ajinomoto inside, they have no impact. They are so numb already because they eat so much Ajinomoto, they totally cannot sense Ajinomoto in their food anymore. Right. So there's also that part. But that is when you make like lifestyle choices. If you're healthy, you should actually be able to feel the negative impact of your lifestyle choices. However, when you take supplements and supplements that are meant to be good for you, and then you have these reactions, then Dr. Jansen's, I totally agree, Dr. Jansen. That means you are less healthy than a normal person.
Thank you, Dr. Jansen. Thank you, Sir Shyan. Okay, for our next question, coming from Miss Jean. Question is, which is more effective? The 20 tablets before breakfast or 10 tablets 2 times a day?
Depends on what goal you want to achieve. Yeah, it depends on what you want to achieve. If you want the therapeutic effect or it would be better to take the 20 all in one go. If you want the absorption, but if you want the detoxing effect, better to space it out. Yeah, that's me. That's me. I don't know with Simply Nature.
For me, I totally agree with you. For me, the other one is the lazy factor lang. I usually take it one shot, 20 in the morning. And I make it a routine so that it's something I wake up, I drink half a cup of warm water, that I take my tablets even before I take breakfast. That's just my routine. And there are times where even after I take in the morning, before I sleep, I might also take, especially if I'm very tired, right? Then I just want to make sure that don't forget the basic benefit of PPAR tablet, not the extracts, the tablet is a superfood. So I just want to make sure my body has a wide variety across the range of very bioavailable minerals and vitamins and phytonutrients, just so that when I sleep, as the body goes into repair mode, there is some building blocks for it to use lah. Yeah, so that's how I do it.
Thank you, sir. Thank you, Doc. Okay, very interesting but good question coming from Mr. Joel. Question is non-instant cereal a whole food plant-based?
Okay,
that's a good question because they're trying to be healthy, Doc. They're trying to be healthy. So yeah. Is rolled oats considered whole food, plant-based whole food?
Okay, this is semantics, okay? A cereal, okay, so let's go by definition. If you go on the internet and search for the definition of a cereal, it is basically whole grains. It's a grass that's made into grains like your corn, your rice, your barley, your wheat. Yeah, so these are cereals, okay? Cereals are basically whole grain. So eating whole grains are whole food plant-based. Okay? Yeah, so that's the definition.
So the rolled oats that we make the Quaker oats, right? Is it Quaker oats in Philippines also, right?
Quaker still, yeah, it's also Quaker.
But cornflakes is not. It's cornflakes and breakfast cereals like your Fruit Loops. All these are not plant-based whole food. In fact, they're very processed and a lot of
processed. Yeah.
Okay, so that is not. Oh no, Doc, I have a question. There was a huge trend, and I think it still is, and it definitely looks very healthy. Is muesli? I don't know how you pronounce it. Granola muesli. Is that healthy?
For me, the sugar is too high.
Okay.
It's too sweet for me. It's too sweet for me.
Okay.
But it just tastes weird. I don't know. I've tasted these granolas. They taste weird. But if you look at the nutrition facts, they have very high fiber content.
Okay, so that
Yeah.
helps.
So, well, personally, I don't love them. I
Okay.
really don't like them. But if you're someone who loves granolas, eating granolas, just make sure that you eat these granolas together with your big meals. Okay, never as snacks or never to replace any meal.
Because they're very high sugar content.
Yeah, the sugar.
And I know why you replace your meal with granola, because it tastes good. All right, it's almost sad to say things that taste too good are usually too good to be true also. But yeah, granola bars are actually very sweet, very high sugar content, even though they are high fiber, which binds the sugar. Yeah, but maybe it's still better than taking a bar of chocolate. So yeah.
Thank you, Sir Sean. Thank you, Doc Jansen. Okay, for our next question, coming from Miss Elia, can people take Simply Nature Cleansing Plus for high blood pressure?
No. It's not for that.
It's not a solution. Yeah.
It's not for that. But you can take it.
You can take
it. Patients who have hypertension can take the Cleansing Plus, but it should not. The Cleansing Plus is not a treatment for the hypertension.
Yeah.
Okay, be clear about this. Okay, be clear about this. No harm in taking fiber supplements for hypertensive patients. No problem. But if you're thinking that it might cure, no. To replace the maintenance meds or the antihypertensive meds, no. It's not a replacement. Okay.
But maybe it makes it safer in the morning when you go, yeah. Because if you have hypertension, when you go and constipated, your blood really. But it doesn't help the hypertension.
It doesn't. Okay. Here's another tip. Okay, do not take this close to your medications. Space at least 2 hours. Okay, because fiber might because fiber is a binder. It might influence the absorption of the medications. Yeah, space at least 2 hours.
Thank you, Doc. Thank you, Sir Sean. Okay, next question. Coming from Miss Air.
Wait, Sheila, I just want to thank Miss Reyes for thanking us. Miss Reyes just thanks you for your response. I think she benefited from it. Yeah, Sheila.
All right, thank you, Miss Reyes. And of course, the next question. Okay, just a second. Okay. Coming from our online shop, question is, does your products have certified therapeutic benefits?
Okay, here, let's just put it this way. There are third-party studies studying the active ingredient of Simply Nature PPARS, which is Chlorella sorokiniana, and they showed there the therapeutic indications, the benefits, the measurements. So these studies or research papers are published in medical journals. So let's just put it that way.
Thank you, Doc. Sir Sean, would you like to add something on that?
No, I'm fine. Yeah.
Okay. All right. So, okay. I think this will be our last question for tonight. Question is, okay, coming from Mr. Alex, I just bought the PPARS powder. However, I feel that it is a little bit sour.
Oh, okay, I'll answer this question. All right. The taste of, okay, so many clients and patients come to us and say, the powder tastes sour. If this is your first time and it tastes sour, you are shocked, right? So I'll just share this with you. Patients have come to tell us the powder tastes different from their previous batch, or it's not what they expected. And then they actually come to our office, right? We always welcome you to come to our office, right? Then we will also try the jar that you bought. And I will tell you, 100% of the time, the powder tastes normal to us. Okay, and the reason why is that unless the PPAR powder that you bought, right, was not properly stored, if the wrap is in place, there was no spillage of the powder, you bought it and then you eat it, you open and used it within a month of, or just 1-2 weeks of buying it. You didn't put it in the shelf for 6 months and forgot that you bought this thing. Okay, if that's why you will notice that our shelf life on the PPAR powder extracts that you buy is still very long, because we actually keep a very how shall we say, fresh supply. We try to make sure that because we know these are for cancer patients, right? So the moment the product is manufactured, then we don't keep it for long. We make sure we modulate our volume so that you get a fresh batch. Seldom do our products with a shelf life of actually 2.5, 3 years. Most of the products reach the patients within less than 9 months. So they have very long shelf life ahead. So there shouldn't be an issue at all. Okay. But we are always very comfortable. If you really not sure, you can always come down to our Manila office in BGC and we'll be happy to taste. But the reason why the powder may taste different for everybody is because when your health condition changes your taste buds. All right. So it shouldn't taste sour, but there could be many reasons why when you put it in, it tastes sour. Okay. Yeah. If you are in doubt, take a picture of it, send it to your CSO, and then we will take a look. But yeah, shouldn't be an issue. And doc, any experience if patient tastes sour? Is there a common deficiency that causes patients to find it to taste sour?
Well, the way I would
patients say taste metallic, yes.
Yeah. Okay. It might be because of the product itself. Okay. Yeah, it may be because of the product itself, but alterations of tastes, usually it's just metallic taste. Then you might, you're sick. So if you're sick, then you will have a metallic taste, no? I just don't know with TCM. So TCM practitioners will interpret this differently.
They will actually use this tasting as a factor. In fact, let me check right now.
Yes.
Actually, this is actually a very good question, because we do get some feedbacks from our clients that for some of them, our PPARs taste a little bitter, but for some of them, it tastes a little sweet.
Yeah, to me it's sweet. Yeah,
it's
to me it's
different from patient to patient. Yeah. All right. And of course, I just want to remind everybody now, our PPARs, when you order that, Sir Shyan is correct. It's usually when you see the expiration date, it's 2 years, 3 years expiration. But we have this reminder that we always say there's a product after opening date that we encourage everybody to consume after 3 months. So you can take the freshest of its form, technically. Okay.
Okay. Thank you, Doc. Okay, so this is in TCM, right? If something tastes sour, it's got to do with your liver and spleen. So there could be some weakness in your liver and spleen. So if you want, go ChatGPT and find out a bit more. It's it's interesting. It's not hocus pocus. This has 5,000 years of history. All right, a lot of observational correlation for them to come up with this. So yeah, this is just what I'm just saying. Just an initial search, right? Yeah, if there's a sour tasting, there is an imbalance in the organs, and yeah, the liver is the first organ to look at. But again, TCM is quite complicated. There are many combinations, which is why you want to see an old doctor when you want TCM, right? Or someone who sees many patients. But that again is just to show you that your health condition will affect the taste when you take health foods, right? Especially foods that are meant to heal you or to help you detox, or and it's not just for pleasure. Then yeah, there will be an effect on the taste.
Thank you, sir. Well, our questions for tonight are really productive. We've been
very interesting today. Yeah.
Very interesting. We've talked about unusual reactions. We've talked about taste, and it really differs from patient to patient. But I guess what I just want to say is that regardless of how you are taking it and reacting on it, it's usually turns up on a positive note. Okay, when it comes to PPARs. Okay, well, that's actually our last question for tonight. Wow. And of course, in the interest of time, before we wrap up, I just of course want to ask for a very quick parting words for each one of you. Dr. Jansen, would like to start off?
Flu is so famous or so popular nowadays. Everybody just want to get one. So everybody, just a few precautions, no, especially for the cancer patients out there. Since you are immunocompromised, always wear your masks. Just remember how you behaved during the pandemic, during COVID season. That's how you should be behaving now. Okay, always wear your masks. Practice physical distancing. Okay, and hand washing as well. All right, so that's it. And if you do get sick, don't panic. Just go see your doctor and get your meds, get some meds, no? So thank you everyone for watching, for listening. I'll see you next week. Bye. I'll give the floor back to Sir Shyan.
All right, thank you, Doc. Today is fun, and you have actually piqued my interest, making me remember the TCM courses I went through. So I just want to answer the sour thing again. Like, okay, spleen qi deficiency, right? So the other signs that accompany this sour taste in your health is poor appetite, easy bloating, fatigue after eating, right? Then there's a tendency that when you eat stuff, they suddenly have a sour taste when they shouldn't taste sour, right? So you can see it will be correlated with other symptoms, like you're feeling fatigue and things like that. Then you will interpret the sourness as, oh wow, okay, there is a deficiency in your spleen. Now, what's the function of your spleen? In Western medicine, the spleen is very important part of your immune system. It's where it stores your immune cells to be redistributed, to put it simply, right? So the another one is damp heat in the middle jiao. So then you also want to look at the coating of the tongue as well. Okay, but I'm not trying to, number one, I'm not dismissing any concerns that you may have. It's just that 100% of the time, when patients actually bring their product that they think tastes different from their last batch and bring to the office, 100% of the time, it has always been normal. And it's because their health condition changed. That's why the taste also changed. Of course, this happens to us. We are not surprised by this because anybody who buys our extracts normally has a serious illness. Okay, so healthy people don't taste PPARs and find it funny taste because number one, very few healthy people actually buy our PPAR extracts. So I'm one of the few because we produce it, right? And so we're not surprised that patients and clients will say that, hey, this product tastes a bit weird or funny. But again, to properly answer your question, if you have any doubts, please feel free to make a trip down to our office, bring the jar, all right, and we will validate it for you. Okay, we will be able to give you a taste. And correct. So we're always here. All right, we're always here. So thank you again. Tonight has been interesting, and I would say tonight's conversations, the questions were a bit more positive and very hopeful. So it was a lighter program today, and I also enjoyed the questions. Thank you very much, everyone. And I hand the time back. We'll see you next Thursday. But more important, if you find this style of conversation fun, if you wish that you could follow up with a microphone and ask us, right, then come for our SMX. It's just in 3 weeks' time. Okay, November 15, Saturday at BGC SMX Aura. Okay, not MOA. Don't go to Mall of Asia. Go to BGC, Bonifacio Global City, SM Aura. Okay, and we will be there. Dr. Jansen will be there. I believe Dr. Joy will be there as well. And most importantly, we will have a free flow conversation where you can, when we give answer, you can immediately ask us questions and we can immediately ask details from you. And it will be a lively discussion. So we hope We'll have as many of you there in person as possible, and we'll have a good time together. All right, so I hope to see you. SMX, mark down your calendar, November 15, Saturday. I'll hand the time back to Sheila.
Thank you, Sir Sean. Thank you. Okay. Well, once again, thank you so much to our experts, Dr. Jansen Calalan and Mr. Shyan Lim, for sharing your knowledge and insights to our viewers tonight. And of course, we hope to see you again next week for another empowering session. That same day, same time, every Thursday night at 7:30 p.m. This October 29, we'll discuss avoiding metastasis after diagnosis, importance of taking immediate action at the onset of your diagnosis. Now is the time to prioritize your health and your family's well-being. Experience the proven benefits of PPARS at an unbeatable price to take control of your wellness journey today. You can now buy your PPARS liquid extract or PPARS powder extract with no shipping fees. So whether you are ordering from Metro Manila or anywhere nationwide, you can avail this free shipping promo only. So once again, only available via website, that's www.simplynature.asia. Now, present the ultimate gift of health this Christmas for your loved ones with our Kickstart gift package, which is a 15-day immunity booster, or the Power Pack gift package, that's 5-day immunity booster, both 100% natural to support and strengthen your immunity. I know you're thinking about gifts to give your loved ones. This is the best one, okay? So please don't miss the early Christmas promo. That's buy 8 and grab an extra package for free. Wow. And of course, don't forget to bring them face-to-face in our health conference entitled Defying Cancer Diagnosis, Thriving with Science and Nutrition. That is next month, November 15, Saturday at 8 a.m. at SMX Convention Center, SM Aura, okay, BGC Taguig. Guys, I just want you to please watch this very quick video.
Hi, I'm Jhen, PPARS expert from Singapore. If cancer is an important topic to you, your family, or a loved one, and you have lots of questions about cancer diagnosis, treatment options, or even how to prevent cancer recurrence, then we have the perfect solution for you. Mark this down on your calendar, November 15th, Saturday. Join me and Dr. Jansen Calalan, one of the leading experts in integrative cancer treatment, as we host the Defying Cancer Diagnosis Conference. From 8 a.m. to 12 noon, we will be exploring how PPARs, peroxisome proliferated activator receptors, can be a success factor in your fight against cancer. We will also be looking at successful cancer cases, and of course, the most exciting segment of our program, which is the live questions and answers segment, where Dr. Jansen and I
join us
will
for
be
a
sitting as a
transformative morning
panelist to
as we dive into
answer all your
cutting-edge
questions
insights.
as honestly as we can.
Okay.
So if you have questions on whether you need surgery, when to do, what type of scans, how do you blend conventional oncological protocols and natural support or even natural treatments, this is the place for you. Ask your questions as we explore the answers interactively and honestly together. So tickets and seats are limited, so please register with the link below. Dr. Jansen and I and our entire team will be looking forward to supporting you and answering your questions on November 15, SMX Aura, BGC Taguig City. See you there.
So join us for a transformative morning as we dive into cutting-edge insights on medical, nutrition, oncology, and syempre, hindi mawawala ang PPARS in cancer treatment. So thank you once again for watching Simply Nature webinar powered by Simply Healed Medical Group or Simply Healed and Simply Nature International, because your curiosity and victory about your health condition is what fuels our mission. Here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all.